Hello all, and thank you for joining me on this brief video. Lyme disease is the #1 vector-borne disease epidemic worldwide. It's often misunderstood, controversial, and challenging to treat. Natural treatment options do exist, and I'm so glad to be sharing this information with you today. Just to briefly introduce myself, my name is Dr. Kristen Bobik. I am a chiropractic physician with specialties in acupuncture and nutrition. I teach for several organizations, and I also own a private practice in the Chicago suburbs. Let's go ahead and jump right in. Lyme disease is caused by a bacteria called B. burgdorferi, but Lyme disease can actually have multiple co-infections at the same time. It is most commonly transmitted by ticks and other insects. The initial symptoms of Lyme disease could be rash, headache, and fatigue. The specific rash that is unique to this condition is called erythema migrans, and you see an example photo of this in your upper right corner. Now, of course, this photo is very dramatic. Rashes can be much more subtle than this. Lyme disease is diagnosed based on symptoms, physical findings like the rash, the possibility of exposure to infected ticks, and serum testing by multiple lab tests. Lyme disease can be treated successfully with medication during the first few weeks of exposure, but many people do not get the help they need. Now, if you're watching this video, you may be wondering if you have Lyme disease. And you might also be wondering, what if I didn't get the treatment that I initially needed? Well, here's what chronic Lyme disease can look like. It can have intermittent migrating arthritis pain, memory loss, tingling, numbness, and other symptoms. Chronic Lyme disease mimics disease processes like chronic fatigue syndrome, fibromyalgia, rheumatoid arthritis, and lupus, MS, memory and concentration problems. And the scale on which these symptoms can occur can vary greatly. I've had patients who their symptoms were so severe that they were practically bedridden and unable to hold down jobs. So this can vary greatly. As a natural, holistic physician, one who does not do prescription drugs or surgery, I have had the privilege of working with some amazing practice members who have Lyme disease. And what I've come to develop is a three-pronged approach. The first part of the approach is lifestyle changes. These are things that you need to do at home. This is going to involve the elimination of all grains. And I do mean all, at 100%. When you go through the grocery store, sometimes you see items that say that they're gluten-free. Well, that's great, but gluten is only one grain, and those products are made from a bunch of other grains. So your diet primarily needs to consist of dark leafy green vegetables and safe animal proteins. This will also include the elimination of all forms of sugar, coffee, alcohol, and cigarettes. Your sleep time, which is the body's time to heal, napping and resting, will need to be prioritized, and there can be no vigorous activity. The second part of the approach involves nutritional, physician-grade supplementation. You'll begin with your basics. Your foundational supplements are probiotic, vitamin D, omega-3s, and include many others. Some patients will also have the successful potential for detoxification programs or additional unique testing. The third part of the approach involves the use of a CAM therapy. A CAM therapy stands for complementary and alternative medicine, and this is a very broad category that could include many things, everything from acupuncture to chiropractic to massage therapy and many others. The purpose of using these therapies is simply to improve the body's ability to function. And that's what real health is. When you function well, your interference is removed from the body will heal quicker and the immune system will be supported. In some cases, there's also a need for aggressive physical therapy protocols. Now, of course, this is a very abbreviated version of my three-prong approach, and every single person will require a unique protocol. No two people are the same, even if they have the same condition. With a condition as serious as Lyme disease, that begs the question, why doesn't this get diagnosed so people can get the help they need? Well, my short answer to that question is that, first of all, it's controversial. There are physicians that do not believe Lyme disease exists. There is also not a single definitive test for Lyme disease. The testing required is often extensive, inconclusive, and can have false negatives. Lyme disease can also be very difficult to treat if it's chronic, meaning greater than 1 year. And it's also hard to diagnose due to all of the various symptoms. As I just mentioned, chronic Lyme disease presents and mimics many other conditions. And finally, long-term medication use that is often seen with people who've been diagnosed within their first few years of having Lyme disease has a lot of risks and side effects. So a person's condition may not necessarily improve. Everything I've shared with you in brief format not only comes from my experience in the clinic, but it comes directly out of the research, both by journals for CAM therapies and the CDC. The research says that probiotics as a nutritional supplement will counteract the effects of antibiotic treatment, and they'll enhance immune function. The research also shows that a high carbohydrate diet will create an environment that is ideal for Lyme disease to worsen. The research also shows that detoxification therapies to reduce secondary responses to molds and neurotoxins due to your decreased immune system response can be very effective. And overall, the research shows that the treatment of the infection can be accomplished through classic antimicrobial therapy as well as CAM therapies. I know I've just shared a lot of information with you quickly, but I've barely just scratched the surface. If you suspect that you may have Lyme disease, here's what I'd recommend doing. First, begin a daily journal. You should write down anything and everything in this journal. One of my favorite sayings is an old business adage: you can't manage what you don't measure. In this journal, you should write down the hours that you slept and how your sleep was. What types of activities do you do throughout the day? Do you get activity? Do you spend your day seated at work? And so forth. You should write down the foods that you're consuming, medications or nutritional supplements that you take, anything else that you think could potentially be helpful. The more information, the better. Then, I'd recommend visiting your primary care doctor to consider laboratory options for diagnosis or to rule out the possibility that you actually have another condition. And then I would pursue alternative CAM, complementary and alternative medicine, providers for specific treatment protocols unique to your health needs and to get started on a nutritional supplement regimen. If you are in the Chicago suburbs, I'd invite you to check my website, thebalanceddoc.com, to schedule an initial consultation with myself, Dr. Kristen Bobik. It's been my pleasure to share this information with you today, and thank you.